Good morning. I want to thank all of our participants and all of our viewers for tuning in today. This is the Pitt County COVID-19 media session. This is session number 17 for May 14th, 2020. We have some opening remarks from Dr. Silvernail, and then we'll open up for question and answers, starting with Dr. Silvernail and then moving on to all of our municipal and community partners that are also on the call as well. So we'll go ahead and get started with our opening remarks from Dr. Silvernail.
Good morning, Pitt County. Today marks 4 incubation cycles, or 8 weeks, since we identified the first case of COVID-19 in Pitt County. The infection continues to occur in Pitt County, but our data continue to show favorable trends. And I want to move on and jump right into that. This is our Pitt County cases over time by date of specimen collection. When you look at that, you can see that our range is anywhere from 0 cases to 9 cases per day. We average that out today, and we average out at 2.97 or 3 cases per day across that roughly 60-day span of data collection. This is the state cases by date of collection. Again, you can see there's some relatively small numbers in that gray shaded box, but those will likely fill in as more data comes into the state. The gray box represents an area where they expect to receive more results, and they will update that as those results come in. This is our cumulative case curve. You can see we're up to 178 cumulative cases as of this morning. The curve has the curve will always go up because we don't remove cases from this, we just add cases to it. But you can see that there appears to be maybe a little bit of a shouldering off or leveling off of that curve in terms of the rate that cases come in and the climb of the curve. Here's the comparable state curve, cumulative number of COVID-19 cases by date of specimen collection. And you can see the same trend in the state. Again, the gray shaded box is an area where there's some uncertainty in the number of results, but the state curve does appear to have leveled off. It will continue to go up because this is a cumulative case curve, but the rate of it going up has leveled off. This is probably the most important graph of the bunch to look at. You can see that back in late March and into early April, we were running about 20% positive in our testing returns. One day we were even at 21% and change. Beginning on April 16th, we noted a drop of a couple of points, and that trend down has continued. And as of late yesterday afternoon, we used our afternoon data run to create this graph. We were at 7% and change in our percentage of testing positive. So for every 100 tests run, we have 7 people that are positive. I think that's a good number and a good place for us to be at this point in time. This is the same chart from the state showing percentage of positive tests as a percent of total returns. You can see there the peak of this was also in the mid-April range for the state, and they are currently showing a return a percentage of positive as about 5% across the state. So that takes in some very low volume counties as well as the high volume counties. This is kind of the summary slide for us that shows the total number of tests run or that we are aware of being run in Pitt County. We realize that we're not necessarily getting every negative test reported to us. So the negative test should probably be a little bit bigger, and the total test would also be a little bit bigger. But at this point, we know we've had 2,544 individuals tested. 2,366 of those individuals have tested negative. 178 individuals have tested positive. We estimate that there are at least 125 recovered individuals in that group, and we to date still have only had 2 COVID-19 related deaths. Want to move on and show you a comparison with our flu surveillance. This is something we call influenza-like illness, or ILI surveillance. This is done every year. The red line represents this year's flu season. The tall point, which the gray and the black look pretty much the same to me on this, but there's sort of a gray and a black in that graph. The very tall point was the flu season of 2017, 2018, where we had an ILI rate that approached 11%. Most years it's in the 5 to 6% rate. The baseline is considered 2.4%. So you can see that the red line climbed, reached its peak in February and started to drop off. By the beginning of March, we began to build the sort of that shoulder wave that we've seen in spring the past few years. And in the March 21st range, that curve began to take a steep drop, which coincides with the implementation of our social distancing strategy and stay-at-home strategy. And you can see that the influenza-like illness rate dropped off precipitously and is now down to its summer baseline of about 1%. The reason I show this is that influenza is spread in the same manner as COVID-19. So if we can show an interruption in the transmission of influenza, we have likely created an interruption in the transmission of COVID-19 as well. And let me move on before I show you that slide. A couple of general public health points I want to hit with you for this morning. Mosquitoes, this question seems to come up and up again. Yes, it's mosquito season. No, mosquitoes do not spread COVID-19. Please remember to tip and toss containers or other items in your yard on your property that can hold water, as those water containing devices or containers can become breeding grounds for mosquitoes. Sun safety. Many of us have been spending more time on the inside. With the warm weather coming, maybe in the 90s this weekend and some sunshine coming, I'm sure we're all going to be anxious to get out and spend time in that. Please take appropriate precautions to avoid getting sunburned this weekend and in the coming days, but please do enjoy the warm, sunny weather. And COVID-19 does not survive in the sunlight for very long, by the way. Finally, please go home and stay home when you do not have a reason to be out and about. Please remember to, now we'll bring up the graphic, to wear, wait, and wash. Wear a mask when and where appropriate. Wait 6 feet from others in public to, again, interrupt the transmission of the virus. And please wash or sanitize your hands frequently. Thank you very much.
Okay, Dr. Silno, if you just want to stay at the podium, we'll go ahead and jump right into any questions that we may have for you. And then afterwards, we'll open up the floor for questions to any of our other municipal or community partners that are on the call. So starting off with Ariana Kraft, WNCT, do you have any questions for Dr. Silvernail?
Yes, thank you. Good morning, Dr. Silvernail. As you know, the beginning of the coronavirus, we are seeing more and more new symptoms to look out for. So I just wanted to ask if there's any guidance on any new symptoms that people should watch out for when it comes to the coronavirus.
CDC has expanded its symptom list, Ariana. I'd encourage people to look at that on there. The big ones still remain fever, cough, and shortness of breath. Body aches have been added as one of those new symptoms, probably less intense than with influenza. Sore throat, generalized fatigue, malaise, GI symptoms, or stomach and bowel symptoms seem to be a little bit more common. One of the early case series said that diarrhea occurred in about 3% of cases. There's a more recent series where it may occur in up to 50% of cases. So this continues to evolve. And if you have suspicions or think you may have been exposed, we would encourage you to talk to your provider and consider being tested.
Certainly, and kind of going off of that, are there any new problems with the virus that you've noticed that you think is important to touch on when it comes to people or patients that are dealing with the coronavirus?
I'm sure you're referring to the multi-system inflammatory syndrome that's been reported. Many of these cases were in New York City. These involve young children who present with a inflammatory syndrome that may be related to COVID-19. We sometimes see these syndromes in children with other infections, and it has a resemblance to something called Kawasaki syndrome or Kawasaki's disease, which doesn't have a clear etiology. We think that Kawasaki may be viral. Some people suggest that it may be more of an autoimmune phenomenon, but it does occur in children, involves some inflammation of mucous membranes, sometimes some involvement of the kidney or heart blood vessels. but is generally a relatively uncommon thing. Both the North Carolina Department of Health and Human Services has issued guidance on this to clinicians across the state. And I know the New York State Health Department put out a publication on this as well, which I have a New York State medical license still, so I still get those things. And I did share that with our local medical community as well, as it was a good document.
Great, thank you. And as we continue to get more guidance from the governor regarding gatherings and things like that, do you have any advice for church services? As we know, instead of moving from the outdoor and larger gatherings to a smaller indoor services. So any advice there to churches and how to proceed safely?
Yeah, first of all, I want to recognize that the opportunity to worship is a First Amendment right, protected right. We are still subject to the governor's order, and I would not encourage anybody to break the law in that regards. In terms of worshiping safely, making sure that you maintain your distancing from others in church, maybe sitting every other row in church, making sure that family groups sit at least 6 feet apart in those every other rows. There was an interesting report out earlier this week from the CDC about the spread of COVID-19 in a church choir, where one individual was positive in that church choir and managed to infect about 87% of the church choir. So limitations on singing, group speaking, things like that probably would be a good idea in order to help prevent sort of a massive release of this if there were folks infected in a church audience.
Thank you very much. I appreciate your time.
You're very welcome.
Okay, next up, WCTI, Tyler Hardin. Do you have any questions for Dr. Silvernail?
Yes, good morning, Dr. Silvernail. I just wanted to see if there was an update on the testing site in the Walmart parking lot, if you had any new numbers on that, and if there was any possibility of other COVID-19 testing sites in the county.
Deep breath for me, Tyler. The Walmart site has been up and running now for about a week and a half. This is sponsored by the Federal Department of Health and Human Services in conjunction with North Carolina Department of Health and Human Services. We have no control over this site. We are awaiting data from this site still. I have been in contact with the North Carolina Department of Health and Human Services. They assure me that they have received the data from the site, but they have not yet been able to process that and share it with us as the local health department. So we are still waiting for those results. And as I said, when we do have those results, we will include those in both the county composite data or total data, as well as showing that as a separate testing site so that we can see what we're seeing at that site. Now, not everyone tested at that site because the draw to that area is more than Pitt County. So there may be some non-Pitt County residents who are tested at that site. That data will not be presented to us, again, because public health reporting is by county of residence.
Okay, well, appreciate that update. And do you also have an update on the prevalence study that you all are working with ECU on?
We continue to work with that. We're meeting with ECU at least once a week and have several email conversations, I think almost on a daily basis with them. And I think we're getting closer to being able to pull the trigger on that. And there will be a part one, which will be a survey. And that we can enroll almost as anybody who wants to take the survey. From that survey population, the principal investigator for the study and his team will create a cohort of individuals willing to continue to complete surveys and subject themselves to testing, which will likely include both a nasal swab and a blood test going forward for several months.
Okay, and just wanted to, you probably saw this coming, but is there any updates on the age range of the cases here in the county?
As far as I know, Tyler, our youngest, I think we said, was 2, and our oldest was 78. I believe that range is still accurate.
Gotcha. Awesome. Thank you, Dr. Silvernail. I appreciate your time.
You're very welcome.
All right, next up, we have the Daily Reflector, Elizabeth Johnson. Do you have any questions for Dr. Silvernail?
Oh, yes, I do. Yes, good morning, Dr. Silvernail. On May 5th, 9 people tested positive for coronavirus, and on Friday, 7 people tested positive for coronavirus. So can you kind of talk about the significance of this?
So on May 5th and May 7th, there were 3 people who tested positive.
Friday. I meant Friday.
May 8th would have
Friday,
been
which
7th. I think that's within, again, we've seen a range that 9 is the highest we've seen in the whole 60 days. Excluding that as an outlier, the highest we've seen is 7 on any given day. I don't know that there's any significance to that. I think that's within the fluctuation that we've seen in the amount of positive test results that come in on any given day. We've also had some days in the run where we've had no people return with positive results.
okay. And some local leaders, such as the Greenville City Council, are talking about, a regional reopening. And so, do you support this regional reopening?
From the standpoint of, is it potentially safe to do some sort of local or regional reopening strategy? I do believe that would be safe. If we follow our social distancing guidance, follow our hygiene guidance, if we mask when appropriate, I believe that we can allow our citizens to start to return to a new normal and move around a bit more than what they have been allowed to do. Yes.
And this new normal, do you think we could do this earlier than the governor's phases, if that makes sense?
Well, for us, I've always said we probably needed 3 to 5 incubation cycles to get to the other side of this. That was a best guess, and I do stress best guess. We're now at 4 incubation cycles. Where we're at a point where we have 7 out of 100 people testing positive for acute infection. Yeah, I think we can do this safely. I'm sorry, I kind of lost you in there. But yeah,
Oh, you're good. Thank you.
Mm-hmm.
Was that it for your questions, Elizabeth, or?
Oh, yes. Sorry. Yes. Thank you.
That's fine. I think we also still have Clayton Bauman, WITN. Clayton, are you on the call still?
Yes. Yeah, I had a question for the doctor.
Okay.
Dr. Silvernail, we received some concerns about employees at a Walmart location in Greenville having COVID-19. We reached out to Walmart National, and they responded saying, we'll refer you to the local health department for any confirmations of COVID-19 cases. Are you able to confirm at any of the locations in Greenville of any confirmed cases of Walmart employees having COVID?
I received a call from one of our local leaders about this just before I left to come to the press conference. Clayton, we will be looking into that to see if there is any outbreak there. If there was an employee who tested positive at a retail establishment such as Walmart, the risk to the general public would be low. The virus just doesn't persist on things for all that long, but we will look into that and provide an update to you.
Is there go ahead. Sorry.
Clayton, I'm wondering if some of that stems from the testing site being at the facility that's been implicated as potentially having an outbreak. If there's some confusion, social media tends to erupt and not always for the right reasons.
For sure. And another part of the email that we received, Walmart saying, while we are not able to confirm any information related to this store at this time, we've been working to ensure our stores are cleaned and sanitized regularly. This response we got is similar to ones that we found on, news reporting in other states where Walmart has been said to have had cases. So it's kind of for lack of a better word, a canned response, if you will. So was reaching out to you to see if you knew of any confirmed cases at the location we're talking about is the Greenville Boulevard location, which is of course where the testing site is.
Mm-hmm. Yes, and as I said, I received a call about that shortly before I left to come to this conference, and we will be looking into that.
All right, thank you.
You're welcome.
Clayton, was that all of your questions?
Yes, it is. Thank you.
Thank
All
you,
right.
Dr. Silvernail.
Thank you. Have a good day.
Okay, we'll also open up the floor now for questions to any of our other municipal or community partners that are also on the call. Just want to recap those real quick. We in-house, we have the county manager for Pitt County, also the emergency management director for Pitt County. And on the call with us, we have Greenville Utilities, Pitt Community College, Pitt County Schools, and the city of Greenville. So we'll go through our media list here to see if there are any questions, starting again with WNCT, Ariana Kraft. Do you have any other questions for any of our other participants?
Yes, I have a quick question regarding Pitt County schools on graduation plans. I know that things are still in the works, but I just wanted to check in and see if there's any new information regarding graduation plans.
Jennifer
Sure.
Johnson?
Yep. Thank you for asking that, Ms. Kraft. As you know, we are busy working on that currently. We do not have any final plans. We certainly are taking the guidance from Department of Public Instruction and from the CDC, from Health Department and all of that. And we did also complete a parent survey that garnered quite a bit of response. But as you know, balancing all of that is a difficulty. So we are working on that internally and of course, keeping safety at the forefront. But we do not have any specific plans yet.
Great, thank you.
Sure.
Okay, any other questions, Ariana, for any of the other participants?
No, thank you.
Next up, WCTI, Tyler Hardin. Do you have any other questions for any of our other participants on the call?
No further questions. Thank you.
Okay, next, Elizabeth Johnson, Daily Reflector. Do you have any other questions for any other participants?
No, thank you.
Okay, finally, Clayton Bauman, WITN. Do you have any other questions for any other participants?
No, thank you.
All right, well, that wraps up today's media session. Our next media session, number 18, will be on next Thursday. As a reminder, we are down to one media session per week now. We're hosting those on Thursdays, again, also at 11:30 a.m. So that next one, media session number 18, will be next Thursday at 11:30 a.m. In the meantime, I do encourage everyone to utilize one of the three opportunities we have for information. That is our website, pittcountync.gov/coronavirus, the hotline at the Public Health Department at 902-2300, or an online information request form that you can find at pittcountync.gov/COVID info. Thank you all for watching.